20 years ago, we used to do patients who were in their 50s and 60s and 40s, had open heart surgery. Since that time, as our population gets older and people live longer, we see patients living into their 80s and 90s. So when I first saw Mr. Roberto, I didn't know how old he was, so I thought he was 70, maybe 80. So I thought he was a run-of-the-mill patient who had aortic stenosis.
So they wanted to give me a blood transfusion every 2 or 3 weeks to keep me alive.
When I talked to Mr. Roberto, we had a back and forth discussion about what should happen. And he basically told me that he would much rather take a chance and have a better quality of life than to come into the hospital every 2 or 3 weeks, get blood, get admitted, and live a poor quality of life.
I lived a good life until 96, and I'm not going to live a miserable life after 96.
Is it normal for us to operate on 90-year-olds? No. But do we see more patients in their 90s having surgery? Yes.
They decided that they were going to operate me the next morning.
At the Heart Institute of New York, we have a mission statement, which is to do every open heart operation through a minimally invasive approach, that when it's safe and technically able to do that. So our bypass surgeries are usually done through a small incision through the left chest, and we do up to 6 bypasses through that small 3-inch incision without opening the sternum. Our valvular heart operations, we do either through a small incision next to the sternum or a small incision in the axilla, whether we do mitral valves or aortic valves. When I saw Mr. Roberto, I thought that a standard sternotomy where we basically open the patient in half and work on his heart would probably be extremely morbid for him, and I didn't think that he would tolerate the operation well or recover well. And when I thought about his particular operation, I thought to be able to avoid a sternotomy and going through a minimally invasive approach and only replace the valve, that he would tolerate well and that he would recover extremely well, and obviously he did.
I thank the 2 doctors for being such good guys. I'm happy, yes.